I'm going to be speaking a bit about healthcare, and I wanted to start by saying that it's a huge pleasure to be here, an honor to be here, and I want to thank Drummond and Ellen for getting me here, and Rachel Johnson for putting 3 or 4 different versions of my PowerPoint slides up in the time before my talk. I'm told that I have about 18 minutes to speak, and that's pretty good. It reminds me of one of the first evaluations I received as a new assistant professor at Yale. It started very promising. It said, "Professor Hacker, if I had just 15 minutes to live, I'd want to spend it in your class." Yeah, because that way it would seem like an hour. Okay, so I will try to make the next 18 minutes seem like 18 minutes, and since I'm going to be talking about a subject that's pretty complex, I thought I would start not with some statistics, but with a story. And the story is embodied in this picture. If you see here, you see a typical American family of 5. You have Arnold Dorset on the left. He's an air conditioner repairman. He makes good money compared with what his father made. He makes about $70,000 a year fixing air conditioners. He makes that $70,000 a year, it turns out, because he's working 90-hour weeks. And the reason that he's working 90-hour weeks, and the reason that his wife, Sharon, on the right here, is staying home to care for their kids rather than finishing her nursing degree, is that it turns out that their son, Zachary, with the football shirt on, has a rare immune system disorder. You see, by the time that Zachary's disorder was diagnosed, the family had already run up $30,000 in credit card bills to pay for his care. They couldn't make their car payments, they couldn't make their mortgage payments, and they were about to lose their house. And so in 2005, when this picture was taken, they decided to succumb to the inevitable, and they filed for bankruptcy. In that year, they were one of 2 million American households that filed for bankruptcy. 2 million. And this is what Arnold Dorset said about filing for bankruptcy. He said, "I make good money, and I work hard for it. When I filed for bankruptcy, I felt that I had failed." Arnold Dorset felt that he had failed. But of course, his story is a story that's told again and again in the United States today. Of that 2 million number I gave you before, we're probably talking about half, 1 million households, are filing for bankruptcy in part because of medical costs and crises. That means that roughly every 30 seconds, someone files for bankruptcy in the United States because they can't pay for medical care. And of course, they had health insurance, or rather, they had health insurance. And this is the thing that we often forget. Recent years, we've seen more and more evidence that those who have health insurance are often ill-protected. For example, Consumer Reports just did a survey. They looked at the underinsured, and they found that 3 in 10 non-elderly adults who were insured were not adequately protected against medical costs. And those who are not adequately protected against medical costs end up doing the kinds of things that those who don't have health insurance at all do. They put off care, they put off other essential expenses, as the Dorsets did. They dig into their savings for retirement or for a rainy day. They make job-related decisions based on health care. And here's, I think, the really striking fact. If you look at the characteristics of this group, the underinsured, they look just like those who have health insurance. They're just as likely to be white, they're just as likely to work for a large employer, and their median income is exactly the median income of the insured. Put another way, these are people just like us, only they're at grave financial risk. And this problem is growing much, much worse. Just the other day, the Commonwealth Fund, a New York-based research organization, released the results of its health insurance survey. And what they found is that between 2003 and 2007, that's 4 years, the number of Americans who were uninsured during the year, or underinsured according to their classification of the underinsured, had risen from just over 60 million to 75 million. That's a 60% increase in the underinsured in just 4 years. So we are heading more and more towards a system in which even people who have health insurance aren't able to pay for the care that they need, or find that they're not able to pay for that care when they get sick. And the scary thing is that they are the lucky ones, in the sense that those who are uninsured are at much greater financial risk. You've probably heard that there's about 47 to 50 million Americans who are uninsured. But I think the number that you should keep in your mind is 1 in 3. 1 in 3 non-elderly Americans go without health insurance every 2 years. That's about 80 million Americans, and the majority of them go without health insurance for more than 9 months. And those people aren't just at risk in terms of their financial well-being, they're at risk in terms of their health care. In 2002, the Institute of Medicine estimated that about 18,000 people a year die, working-age people die, because of the lack of universal health insurance in the United States. Just recently, the Urban Institute updated that to 22,000. But that's not really the scary statistic. The scary statistic is that among 19 rich nations for which we have this evidence, the United States ranks last in preventing preventable deaths before age 75. It's called amenable mortality, and we're at the very bottom of the rankings among all these nations, 19th out of 19. That's actually a little bit of a fall from 5 years ago when we were 17th out of 19. At 19th, we are well underperforming other nations, even though we spend vastly more for health care. Just to give you a sense of what this means, if we had the average rate of amenable mortality, preventable death before age 75, of the top 3 nations, we would have 101,000 fewer deaths a year in the United States. 101,000. I just moved from New Haven to Berkeley. I came over on a 757, seats about 100 people. So 1,000 757s would have to fall out of the sky in a single year to be the same number of people who die in the United States because our healthcare system is so poorly functioning. So these kind of numbers provoke despair. They provoke despair in part because it's unclear what we can do. We have a system that is heavily reliant on employers to provide a basic foundation of security. And what are employers doing? Well, the story is pretty well summed up by this figure, which comes to us from the Economic Policy Institute. The proportion of people who get health insurance from their own employer has declined by 15 percentage points. And this is obviously an understatement of the problem because it doesn't include, for example, retiree health benefits, which have declined from virtually 100% of workers in many industries getting benefits to, we're moving toward a world in which almost no one is going to get retiree health benefits, and they're going to be fully reliant on Medicare. Now, you might think this is just because people who are less educated aren't getting health coverage today, but you would be wrong, because in fact, there's also been a very steep decline in health insurance among people who have a college degree. For example, at the most recent survey time, 40% of recent college graduates entered their first job without health insurance. 40% of people who had a college degree. So we're really talking about an implosion of the employment-based system that we once relied on.